consequences of post-traumatic stress disorder. What I hope to do is to convince you that there are significant socioeconomic and health costs and consequences associated with this condition that we all need to care about beyond the military battlefield. So the first thing I want to talk about as a way of framing our discussion is to focus a little bit on some of our recent national tragedies, which have raised our public awareness for the potential for exposure to traumatic events in the course of everyday American life. And such events have produced not only costs and consequences that can chip away at our national sense of optimism, but also at the mental health of individuals who are immediately affected by them. And one specific mental health consequence of these kinds of traumatic exposures is post-traumatic stress disorder. And I'm going to focus all of my remarks today on this particular mental health problem. So just to give us a context, PTSD is an anxiety disorder that develops in response to exposure to an extreme traumatic event, which is subjective, subjectively defined, like violent assaults, terrorist attacks, military combat, and school shootings. And these experiences or exposures can happen either directly or vicariously. So just knowing that someone close to you has experienced something as traumatic as the kind of events that I just highlighted can actually have an implication for your mental health and well-being. Also, just to give us some background, the diagnosis of PTSD was first added to the DSM in 1980, and the DSM is the Diagnostic and Statistical Manual that we use when we're trying to diagnose patients and figure out treatment plans for them. And it was largely set up or developed as a result of attempts to account for some of the challenging impairments that was being experienced by Vietnam-era war veterans at the time of their homecoming. So in other words, this diagnosis has political weight as well as implications for people's health. But to be diagnosed with PTSD, individuals have to experience a strong emotional response to the event that is followed by persistent difficulty in 3 areas outlined on this slide: re-experiencing symptoms, avoidance symptoms, and hyperarousal. And these disruptions, the disruptions that result as a consequence of these symptoms can have significant impairments, produce significant impairments in people's everyday lives. And the important thing I think to mention is that not everyone who's exposed to such traumatic events will go on to develop PTSD. In fact, there are specific factors that place individuals at risk and also factors that afford them protection or make them more resilient in the face of these kinds of stressors. For example, one risk factor is not having a system of social support in place after the experience of such a traumatic event. And something that might make someone more resilient is being able to seek out social support from people around them, such as their families or friends, or having, for example, in the military setting, a command climate that is conducive to help seeking. So in other words, there are things that can prevent the onset of this condition. But according to recent estimates, approximately 7.7 million Americans, adults age 18 and older, or about 3.6% of the people in our U.S. civilian population, will develop PTSD in any given year. And when we look at the lifetime prevalence of PTSD, which are the estimates, I believe, on the farther left side of the slide, we see that the lifetime prevalence of PTSD is slightly higher, but each of the prevalence rates for both with the 12-month and the lifetime prevalence indicate that the risk for developing PTSD declines with age. So we generally see PTSD onset at around age, I think, 23, but the biggest prevalence rates are in midlife. And I think that has significant implications for how we think about the onset of other chronic conditions that might share comorbidity with PTSD. When we look at our data for the military, the estimates are somewhat less clear. And the reason that is because the criteria that is used to estimate the prevalence within the military is not always this equivalent across the services, and it's not always equivalent. The way that we count PTSD isn't equivalent across those military groups. But I can give you some data recently provided by the Department of Defense that estimates that nearly 213,000 members of the military have suffered brain injuries since 2000, and that about 3,000 veterans who were assigned to conflicts in Afghanistan and Iraq have suffered either from major depression or PTSD. To think about this another way, according to estimates, another set of estimates that not only looks at the percentage, but also the numbers of individuals that are affected, the Department of Veteran Affairs suggests that a little over 300,000 individuals who have served in Iraq and Afghanistan suffer from a service-related condition of service-related indication of PTSD. So I think the take-home message here is that our veterans who are returning from war are affected, but that the weight of the evidence does not suggest, for example, that it is only combat veterans who suffer from PTSD, and I think that's an important message for us to think about. Another thing to think about in the context of today's summit are these racial and ethnic differences that have persisted over time in the prevalence of PTSD. For example, a number of studies, while there are some variations in the findings, suggest that African Americans have a higher lifetime prevalence of PTSD, and Asian Americans also have a comparatively higher prevalence of PTSD when compared to whites. And that the risk of developing PTSD among African Americans once they're exposed to traumatic events is actually higher also than non-Hispanic whites. Some have tried to figure out why this might be, and we've learned that it's not the characteristics of the exposure to the events that actually explain this conditional risk in PTSD, this higher conditional risk among African Americans, so there's something else going on. Some individuals have suggested, researchers have suggested, that part of the reason why we see a higher prevalence of PTSD in African Americans and ethnic minorities is because of the compounded exposure to race-related microaggressions or everyday racism that individuals experience in their environment, such that the PTSD symptoms are enhanced or exacerbated because of these additional exposures. And I think that's important for us to keep in mind as we're thinking about the potential ways in which we might intervene in this, on this condition for individuals in these racial and ethnic minority groups. And we can also begin to understand these higher prevalence rates if we look, for example, at a snapshot of the racial composition of the newly enlisted recruits in 2006 and 2007, which was when we were in the throes of the Iraq and Afghanistan conflict. And the data suggests that the representation of African Americans in the newly enlisted recruits is slightly disproportionate from their representation in the total population. So in other words, there are more African Americans being enlisted that were enlisted during this time period than there were in the total population. And I think that that's really important for us to think about. It may help to explain why, in fact, we see these disproportionately higher rates of PTSD, particularly in this time period that we find ourselves in. Another thing to think about when we're considering prevalence estimates are the gender disparities that we see across time. And even though this data does not show these relationships longitudinally, we have found across a number of studies consistently that women are at greater risk for developing PTSD, despite the fact that men have a greater risk for being exposed to events. So there's something gendered about the experience of stress that actually privileges in a negative way women in this particular context. So why is this important for us today as we're talking about the context of African American economic survival in a post-economic downturn? Well, one of the reasons why it's important is because individuals suggest that some of the unemployment rates that we're beginning to see in our veterans are perhaps they interdigitate with PTSD, that the fact that some of our veterans are not able to find employment has to do, one, with the stigma that is inherent in this condition and the fear on the behalf of employers of hiring veterans when they return to our shores. So I just want to give you a sense of where we are in terms of all veterans. If you look at this slide here, you'll see that over time, there's been a decrease in the unemployment rate among all veterans in the U.S. But when we look, and the pattern is the same as when we look at even veterans who have come home from Iraq and Afghanistan. But the take-home point here is that the decline is a pretty volatile environment for veterans to be employed, and that some veterans suggest that even these numbers mask some of the treatment that they receive once they go out and try to seek employment. So Researchers estimate, in fact, that the economic impact of PTSD, including when we think about medical care, loss of productivity, and lives lost from suicide, some place it at roughly $4 billion to $6 billion, and when we look at a 2-year period. So the costs are significant economically. And here are just some of the voices from prospective employers and some of our veterans about some of the ways in which they perceive they're being treated when they're going out to try to seek employment. So one of the veterans quotes here talks about the way in which people perceive veterans in general, but particularly the fact that they think that everybody who suffers from PTSD is going to be a fly-off-the-handle kind of crazy person, and that because of that perception, they're not given a chance in the economic or labor market. And Marsha Carruthers, who's the president and CEO of the Disability Management Employer Coalition, echoes these sentiments, that in fact some employers are not willing to hire veterans because of their perceived risk in the workplace. These are just some other facts about discrimination and hiring practices, and the take-home message here again is that there are negative perceptions around PTSD that we need to minimize if we're going to create a socioeconomic context that is welcoming of returning veterans and any individuals, in fact, who are suffering from PTSD. Another socioeconomic cost of PTSD is homelessness, and most people in this room are aware that veterans' homelessness has been a significant issue, I would say, since post-Vietnam. But in recent years, we've seen even more striking data to suggest that homelessness among veterans is a problem that we need to pay attention to that might be either a consequence or a correlate of mental health disorders like PTSD, and something that as policymakers that we have to be considerably watchful of. I know that the Department of Veterans Affairs has mounted a huge initiative around veteran homelessness, and in fact, in my White House Fellows class this year, we volunteered for one of the veteran stand-down events that was specifically focused on eliminating homelessness in this population. But it is a significant cost, and I think that we have to think about when we're considering how do we address PTSD and other mental health issues. Some other recent policy advances that are notable here are the Mental Health Parity and Addiction Equity Act, which essentially means that mental health conditions have to be treated with financial parity with respect to billing. The Vow to Hire Heroes Act of 2011, which focuses on trying to get employers to hire veterans and focusing on specific areas in which veterans might bring unique skills. And also recent executive orders that were put forth by the president to increase access to suicide prevention services for all individuals, but particularly for military family members, service members and their families. And of course, the more recent plan by President Obama to reduce gun violence, which embedded in that are initiatives around mental health that I think have significant transferability to the general population. So I just want to leave you with a couple of points. First is the obvious that I've made several times throughout this presentation, and the second also is worth repeating, and that is in order for us to really begin to think about how we're going to address PTSD, we have to broaden the aperture through which we view it. And I think the longer we consider this as something that's just solely a problem that the Department of Defense or the Department of VA, Veterans Affairs has to address, then we can exclude ourselves from the conversation and not think about ways in which we as a society have to share the burden for this condition, because again, it affects all of us and in slightly different ways. And that also, as we're thinking about this in the context of today's summit, that we have to monitor the policy implementation so that individuals who are at greatest risk for PTSD reap the benefits. So we know, for example, that these economic data are mirror in some ways the unemployment rates for marginalized groups. And so if you add that burden of mental health conditions on top of other sort of potentially stigmatizing demographic characteristics, then you're likely to see an exponential increase in the burden of PTSD for those populations. So we have to be thinking about policy implementation and making sure that we smooth the way for individuals who are at greatest risk. And I think the last point I want to leave is for those individuals who may find themselves in the grips of PTSD or other mental health conditions. There is hope. If you are suffering from PTSD or you think you're suffering from PTSD, there are ways to get help. We know that treatment is effective, and we know that prevention works, and we know that people can recover. So I just want to leave you with those thoughts, and thank you for your time today.
Good stuff. But I also want to thank you all for the invitation. I'm one who has always been consumed with and has thought about and struggled with this question of power, okay? I'm a political science major. I'm a first-year doctoral political science student. So when Dr. Green asked me to look at this topic, he asked me what I want to speak on. What I said, I just spit it out. I said from victimization to politicization, okay? My esteemed colleague here, tell me that. Ms. Wisdom, Dr. Wisdom. Dr. Powell. Dr. Powell broke down the statistics, all the stats, the numbers, the Ptsd, the disproportionate enlistment rates we see among African Americans, all the stats and all the numbers, the disproportionate homelessness. We even know what that statistic itself is twice as large for veterans between the ages of 20 and 24, in comparison to those who are not veterans. So we know, those of us who study it, we know the numbers. But the question I'm going to put forth here today is, I'm going to be real short about this, is what are we going to do about it? Okay? We know the numbers, we know the conditions, we know the plight that veterans as a microcosm of the working class within the United States and throughout the world, what they face. What are we going to do about it? So I come to you today not solely as a theoretician or an intellectual, although I am studying for a doctor. I come as one that's been involved in the human rights movement. I come as a practitioner, someone that looks at these issues, and then we struggle and strategize over how best to attack them and how best to eradicate them, how to build a kind of society that we're looking for. So are you down with that? Is that a good thing? Okay. So Lucy asked me, as I was walking in, she said, Jonathan, she's known me for some time. She said, Jonathan, you got to explain something to me. I said, well, she said this Navy thing. Because I spent, as the introduction says, 7 years, 7 months, and 1 day in the United States Navy. And for any veteran you meet, they can break it down to you if they're experienced. And trust me, they can break it. Some of them can break it out to the exact second because you can't wait. At least I couldn't to get out of that situation. Where do we start? Let's start with some numbers. I'll give you a few numbers in terms of where we are, in terms of our military and where veterans find themselves. In 1960, some of us float this term, the military-industrial police complex. Many historians credit a former outgoing president with either coining the term or at least putting it out to the masses at large, and I'm referring to Dwight D. Eisenhower. His final speech as he was leaving the White House, he gave a talk that when I watched it, I was astounded that a U.S. president even gave a talk such as that, and I would want to talk to some people as to what his motivations may have been, but he warned of the incoming military-industrial police complex, the complexities of it, the amount of resources it would strain domestically from the society, and in fact, even the speech went further to say the threats it would bring upon the incoming U.S. population as a result. How does this all tie into this question of economics, right, and really the struggle over resources, this question of scarcity within the society in the midst of the greatest power that the world has ever known? Let's talk about this power here. We're talking about 700 military bases throughout 150 countries around the world, okay? This whole question of deficit reduction and cutting costs. If you go to Veterans for Peace homepage right now, and I know some of you got your laptops and whatnot, the numbers right there in terms of the cost of the Afghanistan and Iraq occupations, and the number is climbing as I talk in the hundreds of thousands. The digits are consistently moving. When I left the House today, it was right at $1.4 trillion, okay? So how significant is that? Well, you have the leadership in the House, which side of the coin you're looking at, but it is a side of the coin that was calling for upwards of $4.6 trillion in cuts over the next 10 years, okay? So that same leadership that would call for $4.6 trillion in cuts, the same leadership that approved, okay, the occupation of Afghanistan and Iraq that cost $1 trillion, all right? So The reason why we have to bring that into the context of this whole question of economics, disparities, and scarcity is, quite frankly, the military, as we know, is not traditionally on the table when they talk about the cuts that needs to be made in the society. When they talk about cuts, primarily they're talking about social spending, Medicaid, Medicare, Social Security, questions of privatization, this race to the top initiative that we see. We see the closing of schools all over the country. I believe 20 schools here in Washington, D.C., if I'm correct. 20 some odd schools being closed. I'm a product of public schools. 20 schools being closed, that's a heck of a hit, but we also see resistance to that as well. And then we also see the expansion of this military complex under our current president, President Obama, who I know many of us voted for, but we see an expansion for many of us, sadly, on the continent of Africa. We see in 35 countries the U.S. personnel are going to be entering into. It's interesting because when I think about Africa and military intervention, one of the countries that immediately comes to mind for me is Libya. And I was a child when Reagan bombed Libya, and I remember the response that the college students in Atlanta had to that. And so I compare that to what recently took place in Libya. And if you know, the New York Times came out this past Sunday with an article that talked about the grim aspects of the Arab Spring. Many of you may have seen that. But whatever your opinions are on Muammar Gaddafi, I got 7 minutes, I'm gonna take about 2. Whatever your opinions are on Muammar Gaddafi, the New York Times put forth that his ouster, which was supported by the United States, is now leading to the backlash that we see in North Africa today, okay? Take that with a grain of salt. So what can we do? I was politicized, well, before I came to Howard, I was politicized, but I was politicized even more on this campus. And I entered the military, Lucy, at the age of 26, primarily not as a form of patriotism, although I do see myself as a patriot of this country, and at least in its ideals, in the idealistic way. But I entered because I was looking for resources. I wanted to pay off those student loans, and I wanted to access some money for graduate school, and now I'm using my GI Bill to help finance this degree I'm working on now. Be that as it may, because of my politicization, I could not respond to the authoritative, draconian environment in a way that I was supposed to, and also saw there was other people on my ship that felt the same way that I did, okay? But we were just taking the mess as it went along. I was off the coast of Iraq, January of 2006, when some shipmates wanted to play a joke in the shop and just wanted to dangle a hangman's noose in front of my face, you know? So I called up this professor at Howard University and talked to him about what to do about that. And so we started to organize. We started to write letters and organize a little committee right there in my shop. We then got in touch with this gentleman, Dr. David Courtwright, who is a professor in the Kroc School of Peace Studies at Notre Dame, but at the time was a member of a movement known as the GI movement. And so the popular culture is one of mass movements of either long-haired hippies or Black Panthers or Muhammad Ali standing in front of Douglas Hall with his book, A Message to the Black Man, saying he wasn't going to Vietnam. But there's also another movement that has just begun to be documented, the reissue of this book, Soldiers in Revolt, Sir No Sir, which I would encourage everyone to watch, and specifically to send it to someone within the military if you know them. If you know a brother or sister in the military, send them a copy of this DVD and get them connected to this history. But it gives an empowering history of how GIs were able to organize themselves within the ranks of the military. And this mass movement was going on within the military, throughout the civil society, the anti-Vietnam protests. We know what was happening here at Howard University, Columbia University, what have you. I put forth here today that really in order to change the conditions that my colleague laid out for us beautifully is to really build a mass movement. You know, that's what we need. We need a mass movement. You know, I'm thinking about a class last semester I took. How many minutes I have now? 3, okay. I was thinking about a class I took last semester, Dr. Don Davis's class, is a book called We Have No Leaders. I mean, the title itself, get that book, We Have No Leaders. You read that book, Doc? I mean, it's a good book, right? I mean, there's a piece in there. I mean, and essentially the title says, we, as in black folks, have no leaders. Because essentially, post the civil rights movement, all of our leaders, the ones who are honest, take care, have a good one. The ones who were honest and forthright, they either took out, slayed them or COINTELPRO'd them, or the ones that they could buy off, they did and consolidated them within the system. The point is, we have no leaders. There was this point in the book where he lays it out, and this is what really blew my head open. It shows the progression of the Democratic Party platform from 1968. So in 1968, for example, you had full employment on the actual platform of the Democratic Party, okay? Now I put forth, that's not because the elite or the oligarchy of the Democratic Party really wanted to put that on there. It's because what was taking place in 1968. As Frederick Douglass said, power concedes nothing without demand. Well, by 1988, the full employment is no longer in the platform. Now, if you know 1988, that's 20 years from 68, okay, that's when about 30% of the delegates at the Democratic Convention were Jackson delegates in Atlanta, Georgia, right? Then we go from 1988 to 2008. We know what happened in 2008. Barack Obama was elected, right? But there's no full employment in the platform. Why? Because there's no movement. You know, there's no mass demand. So I maintain that in order for us to build the egalitarian society we want, stop these massive school closings, 20 schools closing, we see the fight back in Seattle with teachers on the move, for us to bring our brothers and sisters home from all these bases across the world, for us to close these bases, not just bring them home. It's not enough to bring them home. I mean, why is it that we have bases in Germany till this day? Japan, I mean, World War II ended in 1945. I was in Japan. I mean, I spent 3 weeks there. I mean, it's an occupied country. I mean, imagine if there was a Japanese base right outside this university with the imperial flag of Japan right there. I mean, Americans really can't conceive it. So, this is what David Courtwright put forth here. Oh, shucks, look. Hey, I got 1 minute. Join an organization, if you haven't already, that's doing a work for the people. All right, I've been saying that ever since I heard Kwame Terrell here at Rankin Chapel in 1998, February 17th. His piece was, we had to move beyond mobilization to organization. Mobilization seeks influence. Organization ultimately seeks power. Well, that's what we're concerned about. We want power to determine our own destiny, to determine our own lives, and we can't depend on the government structure to give it to us. So I put forth here today that we take it, and I know that after I said this, I began some phone calls to come to a meeting. So thank you. Appreciate you.
Thank you very much to our presenters. I just want anybody have any questions, you can step to the mic over here.
Ptsd was more prevalent among combat, folks in combat or combat veterans. And then the next slide said that it was even more prevalent among females than males. And when that came across to me, I thought about the recent legislation which says now women can go into combat. And I wondered, does that pose some issues for somebody that does your kind of work?
But what my slide did try to indicate was that individuals who were in our recent conflicts, when compared to Vietnam-era veterans and Gulf War veterans, the rates of, the prevalence rates, at least as we understand them, are fairly more similar between Gulf War veterans and, Vietnam veterans and veterans who were engaged in Iraq and Afghanistan. And I think that may have something to do with length of deployment. It may have to do with some other constitutional factors that individuals bring to combat. We just don't know how to disentangle those things. So let me say that. And with respect to women and, the opportunities for women being opened up in the military, I have to say that the female, and I rarely use these two words together because I think a soldier is a soldier or a sailor is a sailor, but the female officers in service, enlisted men and women that enlisted women that I've come in contact with are the most courageous, battle-ready individuals I've ever met. So I think they're up to the task of doing the jobs that have been opened up to them in this recent initiative. So I don't think that we have to have any concern that they're not going to be hardy enough to withstand the tasks, because I think people who go to those positions are going because they believe they can do them, and I have faith that they can. But we do know that women in the military who are in combat locations have reported military sexual traumas. And as a clinician, I can tell you that many of the people that I treated with MST or military sexual trauma were men. So I think the picture is somewhat skewed. Men are less likely to report certain kinds of trauma exposures, which are kind of conflating that PTSD prevalence rate that we see, because that doesn't tell us how many of those had PTSD as a result of combat or some other kind of incident in the course of military service. But I think that we get a rather skewed picture of the impact of these kinds of incidents on men and women. Therefore, we get more concerned about women being on the front lines of battle. So do I think we need to pay attention? Yes. Do I think we have to think carefully about, and I know that people who are more military intelligence than me have been thinking about this. I think that we do need to think about those things that I think we have, but I don't want us to get so overwhelmingly alarmed that we think now all the women who are, for whom those lines of service have been opened up will now develop PTSD. But there is a concern that we have to think about PTSD and its effect on all folks who are in those kinds of positions. So I hope that helps to in some ways answer the question and clarify some of the distinctions, because I don't want you to walk away thinking, that, oh, now we have to be, overwhelmingly concerned that the women who are now going to serve in those capacities will be affected, if that's helpful.
I was hurt when I heard that Jonathan had joined the military, and I appreciate him disclosing the part about the financial component, because I want to ask a question about this. And I actually want to tie it into the earlier panels, which is, and I don't know if these statistics are still correct, but they represent sort of the larger issues that are taking place, and that is specifically that the largest employer of either high school or non-high school graduates for African Americans, public employer, is the military. The largest private employer of African Americans, high school graduate, not high school graduate, is Walmart. And I want to open up the discussion about options for us, because part of the thing when we had the discussion earlier about full employment, well, in some respects, the military is the full employment for us. And then what's the implications of that if that's really where we're sending people for, that's where the resources are. I have a lot of friends that made the same decision as Jonathan, and I understand that. And I was just curious if we could talk about that and what that means. If we're really saying, well, you want to get work, you want to get education, you need to go basically, not just now, of course, in the military, but obviously in a military that's highly active in real ground wars, and most likely that trend's going to continue.
Well, I think I'll respond quickly. I think that, when I was in high school, my answer is going to be somewhat anecdotal. When I was in high school, my mother chased military recruiters off from the property. And then when I was in my middle 20s, it was the same mother who said, well, maybe you might want to think about the Air Force or the Navy in terms of some of the things that I was struggling with. I think first and foremost, I think we have to take a position. I think that we definitely, when I say we, those of us who are, if I can use the term, progressive-minded or anti-imperial in our thinking, certainly we have to make a distinction between the policies of the military and the policies of the government and those who join. I mean, there is a difference. And then even within the ranks, there's definitely a distinct political difference between the officer corps and the enlisted corps. There's a definite difference. The enlisted corps of the military, known as the brass, they're the ones, they're like your company managers. I mean, they are the ones that really, carry forth the line, if I can put it out that way. But your enlisted member, particularly, when I say enlisted member, I'm going to go from E5 on down, because once you hit E6, you're like a middle management. And the E7s, especially in the Navy, but throughout the military, that's really where the rubber meets the road. That's when you become a careerist, okay? But from the E5 on down, that's pretty much the grunt, That's a person that does most, if not all, of the real work, and catches all of the real hell, if I could put that out there. And that's where politically, if you're being scientific about it, because when we talked about that GI movement, some of those people that were organized in the military purposely joined the military to do it, because they understood the analysis, what I just laid out, that you could actually build from amongst the E5 rank on down to potentially build a movement from within the military and push for reform within the structure. What I was going to read at the end, but I didn't have the rest of my time, and then you want to chime in on this, Doctor? The prescription that Dr. Courtwright lays out for building the GI movement in 1975, this is what he lays out. My book is all beat up here. His first point is that radicals must join the Army. He said the role of radicals who purposely joined the services to organize has been important throughout the GI movement and remains so today, okay? He goes forth to say that organizations should follow suit. He names the organization, has done a great job at that, and send members into the enlisted ranks as an indispensable means of exerting direct pressure on the armed forces. The presence of even a few hundred committed activists could have great impact on the level of servicemen's dissent. Okay, that's 1975. That's pretty bold. And then he goes forward to say civilian support is crucial. So civilians supporting these activists from within is crucial. The movement must deal with the basic grievances of the GI, which was laid out here earlier today. These grievances, and also this is before the internet. A newspaper or a newsletter is necessary. And so what we were able to do, which I didn't get into, was we launched what was called an appeal for redress, DAR, in which we took the actual law called the Military Whistleblower Protection Act, which says that any enlisted member of the military without prior command approval and without any reprisals for having done so can send a letter to Congress, to a congressperson, specific congressperson, on any issue. And so we organized a movement around that, which mobilized about 2,000 plus members across the country to do that, and was able to get some pretty good mass support from doing that. But we also learned some lessons from it as well. So, but to answer your question, because the military being a mass employer and Walmart being a mass employer, I think that what we have to do is work within the situation that's presented to us, but fight back from within that structure. See, in other words, this is my last point. There was just a call for a massive protest at Walmart around the Thanksgiving holidays. And as an alumnus of this institution named Rock Newman, boxing promoter, called me up and said, hey, Jonathan, let's go out there and protest. But once I get out there with him, I realized something. I said, we don't know any of the workers in there. We don't have any relationships with any worker in the Walmart, you know. So why would they come out there and come risk their job? Now, if we knew a worker, had a relationship, let's say one of my if I can use the term, one of my partners worked in there, and we could have, organized, maybe built something weeks before, months before, that real long-term kind of base building you have to do in order to bring about an action such as that. I maintain that's what we have to do throughout society, and it's not just a one-shot deal.
As a person who was formerly in the military and whose family members spent a lot of time in the military, I just want to highlight a point that was made, which is the huge distinction between enlisted and officers, and it's largely related to degrees and college completion. And enlisted, right, is usually someone who has not completed college. An officer has to have completed college. There's a racial disparity in terms of who are the enlisted folks and those who are officers. And so the operation of the military at the onset begins an operation that is distinguished by educational attainment. That's it. One of the central points in your presentation, which I'd like you to accent a little bit more and maybe connect to a point that Sandy Darity made earlier, was that PTSD among military folks is exacerbated by the context that they may live in their everyday life, right? And the recognition of pointing out our everyday experiences, especially if you are a person who is black or brown or poor, are filled with traumatic events, but that America itself has some ongoing, especially in this post 9/11 era, some amazingly everyday violent experience. So you take a person who has experienced trauma both on domestic soil, in international soil, they return home, right, and they do not have guaranteed employment, and they have not finished their education. And despite the wonderful thing about the GI Bill, the processes for accepting or having access to these funds are not always easy. So there are challenges embedded in that it would be for if you're a welfare recipient trying to get your check. There's some of those things that are embedded. So there are everyday traumatic and disruptive things co-occurring for a person who has also been in the military, experiencing not only combat, but also the racial and gender inequities that the military has, like all other systems in our society. So I'd just like you to kind of put a little bit more accent on talking about what happens with this co-occurrence or these multiple occurrences as it relates to post-traumatic stress disorder, and what we should be thinking as we think about these issues rather than the labeling.
Yeah, I really appreciate your bringing that back to the center focus, because I do think that point is really important as we think about how we're going to address some of the economic disparities within, particularly for this meeting, African American communities, because a large part of our labor force are going to be these returning veterans, and they're going to come home to our communities and to our families, and they're going to need employment, and they are going to come home to sometimes to a context that is not as inviting, where they will experience everyday racism and where they will face joblessness and other kinds of stigma. So the first thing we have to do at the structural level is to work on minimizing the stigma around mental health conditions in general. I mean, that should be a priority, not just at the national political level, but in our everyday lives and how we think about individuals who suffer from mental illness or from mental health problems. And what you're talking about in particular is about the cumulative burden, the cumulative disadvantage that individuals experience that a lot of us folks in public health talk about, that this experience of discrimination on top of a traumatic exposure, that cumulative burden can produce real health effects, not just mental health effects, physical health effects, as was brought out earlier, higher rates of cardiovascular disease, higher rates of diabetes, more obesity. So I think we have to put this in a broader context and think about the experiences of mental health problems, particularly PTSD, in a broader context. These are socially determined outcomes. And so the reason I was trying to broaden our discussion earlier beyond just thinking about combat veterans, although that's a population I care a lot about, is because if you only think about it as happening to someone else, what if you don't know anyone in the military, or you don't have a military experience? Then when we start having these national dialogues about PTSD, you can tune out. Well, guess what? You need to check back in, because PTSD affects everybody. And if you're not experiencing PTSD, odds are you know someone who is affected by it, or you know someone who's experienced a level of trauma that could potentially put them at risk for the kinds of experiences that I described. So I want folks to sort of tune back into the conversation, and that's why I've sort of tried to move the conversation along. But I do think that this cumulative burden that you talk about is going to present significant challenges for us as a provider community, because people will be coming to our clinics not just with a physical health problem, not just with one set of symptoms, diagnostic symptoms, but with several things going on in their lives. So I always, have been advocating for a more holistic assessment of individuals, that we have to get beyond just asking them whether or not they have had pain in the past, couple of weeks, that we need to really start to do social questionnaires at healthcare settings, and particularly in community-based settings where a lot of folks who are disadvantaged will likely show up. So there's many opportunities for us to think about that kind of initiative, both within the ACA and how it's going to be implemented within community settings, but also as providers who are seeing those patients in VAs and other institutional settings. So the take-home message really is that the cumulative burden that individuals are exposed to has significant consequences that require a multifaceted healthcare team approach in order to bring about wellness in that individual over both in the here and now and over the course of their lives, and also to prevent the intergenerational transfer of those kinds of stressors to their children and families. I think it's critical for us to start to think about.
Thank you very much. If we don't have any more questions, I guess that will wrap up the end of our session. Dr. Green will give some closing remarks. Thank you.
Yeah, and while he's coming up, I want to just bring up the point that you raised about rank. and exposure, because I think it's worth mentioning that the study that Sir Michael Marmot did, the Whitehall study that he's so famous for, looked precisely at rank and control in the workplace and health outcomes. And I think that there's room for us to think about that in a military context, a sort of similar study where we look at rank in the military, mental health, combat exposure, and potential risk for PTSD, because it's not that I think that individuals who are officers can't experience it, but I think the command climate is slightly different for enlisted men and officers, and that the willingness to come forward to express distress might vary according to your rank and your level of power in the military. So I see some room for us in the scientific community to start to think about ways we can expand that work to bring about better solutions. So appreciate that.